There's been so much talk about fear here. Fear, fear, everybody's got a fear, fear. Let's get away from that. It's time to quit talking about fear. Let's talk about hope. Let's talk about the realities of what's affecting people out there and what we're trying to do to make their lives better. Why do we always want to inject fear into people? Let's talk about hope. Let's talk about real people and what this bill does. Mr. President, this is Sarah Posakani of Cedar Falls, Iowa. And here, let me tell you her story. It's just incredible. She was diagnosed with Crohn's disease when she was 15 years old. During her first year in college, she ran into complications, had to drop classes because she was no longer a full-time student. Her parents' health insurance company, or a private health insurance company, terminated her coverage. Then the medical bills piled up. 4 years later, she found herself $180,000 in debt, was forced to file for bankruptcy. Sarah has undergone 7 surgeries, 7. And here's what's disturbing. 2 of those came about as a direct result of her not being able to afford medication. So again, it's an incredible story, but it's a true story. So many people have to go through this. And what our bill does is our bill says, look, you can stay on your parents until you're age 26. And guess what? No pre-existing conditions will apply to you from here on out. Think about Sarah when we're thinking about this bill and the hope that she needs, and so many like her, that we're going to change this system to make her life better. Second, Tasha Hudson of Des Moines, single mother, 3 kids. She had a job which provided health insurance, but she took a new job that paid her more, 50% more. You think, isn't that the American way? You learn, you get better, you get a better paying job. Problem is, the private sector job did not come with health insurance. And despite the higher pay, she couldn't afford the coverage. Now, ironically, her higher pay led to cuts in her Medicaid benefits and loss of child care services. As a result, Tasha is now in the process of returning to a lower-paying job despite its limited opportunities for one reason, because it will provide health insurance for her family. These are real people. These are the people we need to give hope to. Here's one last one. Eleanor Pierce, Cedar Falls, Iowa. She lost her job when her company was eliminated. She had the option of purchasing Cobra, but she couldn't afford it. So she searched for coverage, but because of high blood pressure, pre-existing condition, she was denied access. So age 62, suffering from high blood pressure, no choice but to go without insurance. Mr. President, that's why we need this bill. Not for fear. Let's quit talking about fear. Let's talk about hope for the people I've just talked about. The hope that their lives will be better, that they'll get the insurance coverage they need, that they'll be able to get on with their lives and not have to go so far in debt that they have to go into bankruptcy. Mr. President, if you're a 62-year-old woman with a serious heart condition like Eleanor has and high blood pressure, you just don't have a prayer. You're on your own, and the odds of premature death are disturbingly high. We can and must do better, and that's what we ought to be talking about. Hope for the future, not fear.